Hi everyone, very good afternoon. I hope I'm audible. First of all, can I get a few thumbs up if I'm audible? Okay, great. Thank you for confirming that. I hope you're having a great weekend, all of you, till now. And I really welcome you to the. Yes. uh, So, just a second. Yeah, so very warm welcome to this cognitive processing therapy that we are conducting today. My name is Arpit, and I work as a junior psychologist at MindTribe. I have pursued my clinical psychology master's from Christ University, Bangalore, and I have additional training in clinical hypnotherapy. And I've been working at MindTribe for about a year. And along with me, Manvi will be conducting the session, so we'll both be taking the session together. So uh, I'll hand it over to Manvi to introduce herself before we begin the session.
Hi, Arpit. Can I begin now? Right. Good afternoon, everyone. My name is Manvi, and I am a counseling psychologist with MindTribe. I've been in the field of psychology for over 5 years now, and I specialize in areas such as anxiety, depression, relationships, self-esteem, and stress management, amongst other things. I'm very excited to be here with you all today. Hopefully, it will be a valuable learning experience for all of us. Yeah, thank you. Over to you.
Thank you for that, Manvi. And here is the list of team members that who have helped created this beautiful presentation for you. And also we have the main training, which is the extended training for which dates will be shared later on. This is just the introductory training, whatever we can cover in about 60 to 90 minutes, do our best. Okay, so moving on. Right. So as I told, this training is a brief overview of all the aspects and elements that fall under cognitive processing therapy. We'll cover as much as we can in 1 hour. And before moving on to the presentation, let's talk a little bit about ground rules, and we have a disclaimer. So because there are lots of participants, so we need to establish a few ground rules for a smooth conduction. So, first is that please be respectful towards each other. Be Because we might have interactions in the chat box, so please be respectful to each other and each other's opinion. Then, all that is shared here is confidential, all of the opinions. So please do not spread it anywhere else. So be mindful that it's a confidential session. Then no gossiping or no irrelevant talks related to anything which is apart from the topic. So be vigilant of that. No violence or intimidation, obviously. And also, when you want to contribute something, when you want to speak up, use the hand raise button whenever needed, and will ask you to unmute yourself and you can then speak. And finally, keeping the camera and the mic off because there are many participants, and even if your mic is on or camera is on, it creates disturbance for everyone. So, in order to have a smooth conduction, please keep your mic and camera off. Right. So these were a few ground rules that I wanted to talk about. Next, disclaimer before moving on to the main presentation. So, recording, transcribing, or capturing any part of this group therapy session is strictly prohibited, and this includes the use of transcription tools, screen recordings, screenshots, or any other form of documentation. The content shared in this session is the intellectual property of MindTribe, so unauthorized recording, reproduction, or distribution is not allowed. And please note that the violation of this policy may result in removal from the session to protect the confidentiality of the group. So these were a few things we wanted to discuss with you before jumping to the main session. Now, coming to the topic itself. So, I hope most of you must have heard by now. So, Someone has asked, can we get the PPT or webinar recording after the session? Yes, so the session is being recorded, and you will get the recording later. It will be uploaded on YouTube, but we do not share the presentation. However, you can note down the points that you think are relevant to you. So you can sit with a pen and paper and write everything that's relevant to you. Okay, so moving on to the topic. So CPT is cognitive processing therapy, which is a highly effective approach for helping people recover from trauma and PTSD, and especially all the conditions that arise from the point of trauma. It's especially relevant in those cases. Now, you might be wondering that when we talk about trauma, like, isn't all therapy helpful for trauma? Even though that is a great question, but CPT, what it does is that it stands out because it gives us a map, a clear, structured path on which we can walk alongside our clients as they make sense of their experiences and start to heal. So think of it like being both a guide and a detective. We help uncover hidden meanings, question old narratives, and build healthier ways of understanding ourselves and understanding the world. Someone has asked what PTSD is. So, PTSD stands for post traumatic stress disorder. So, what happens is that if any event happens, let's say you were traveling in a car and suddenly there was a situation of accident, even though nothing happened to you, but that event itself was so traumatic for you that whenever the next time you sit in car, you are reminded of that trigger, and those experiences, the emotion that you felt during those experiences, they start to flow in. Those uncomfortable impulses, they start to flow in. And it also happens with any it mostly happens with the when you are in military and you have seen a lots of violence and destruction, and those things you carry around with you, so they act as trauma points. So PTSD is related to that. We'll talk about it more in detail in the coming slides though. So right. So unlike supportive counseling that offers a listening ear, which of course is important, CPT is more like a focused project with milestones. It was developed by Dr. Patricia Risick in the late 1980s. CPT is usually done in about 12 sessions, each one building on the last. So if you want to picture it as a structured renovation of your home. So firstly, you tear out the old and faulty wiring, and those old and faulty wiring are your unhelpful beliefs. And then you rewire the house. And by rewiring, I mean rewiring our thinking patterns so that the house is safer, the house is more adaptive, and it feels like home again. Then let's talk about what does CPT actually focuses on. So let's break down what we do in CPT. So, firstly, it's very helpful in understanding how trauma affects thoughts. So, trauma can shake up how we see ourselves, how we see others, and the world. For example, after a car accident, someone who used to believe that the world is generally safe may suddenly think that nowhere is safe anymore. And that shift can color every decision and every relationship and every situation that is happening on the same lines from which the trauma was created. Then, secondly, it is used to identify and challenge unhelpful beliefs, which are also known as stuck points in CPT. So, in CPT, we look for stuck points, and stuck points are thoughts like, I should have stopped it, or I'll never trust again, So maybe you've had a client or even a friend who keeps circling back to a sense of self blame after something bad happens. So CPT helps gently untangle these knots. Then, thirdly, uh, it, it helps you develop a more balanced perspective. So we are not pushing clients towards artificial positivity here. Instead, we are helping them say that yes, this happened, but maybe it does not define my worth or my future. For instance, a survivor might move from the statement that I am broken to I went through something terrible, but that is not all of who I am. So that person is not letting that one situation decide his future. So it helps you develop a more balanced perspective. And lastly, it's not about erasing memory, but changing the interpretation of the event. So this might surprise some people that in CPT, we find it's not always the trauma itself that brings the most ongoing pain, but the meaning that we take from it. So imagine two people who survive the same event. One becomes overwhelmed by guilt and thinking of things like that it was my fault, while the other might struggle with distrust. For example, no one can be relied on. So it's these beliefs and the way they play out day to day that fuel suffering long after the event ends. So our job in CPT is to help clients recognize these interpretations and give them a chance to choose something different and something that is adaptable and is in alignment with their desired future and not holding them back. So this is what cognitive processing helps. So these are the four main domains where it focuses on helping clients. So is everything clear till this part? Can I get a few thumbs up if there are none doubts? And okay, thank you for that. Yes, Vidya Kumar, did you want to say something? Okay,
Oh, no, sorry. Instead of thumbs up, I raised my hand.
no
I'm
problem.
sorry. Yeah.
So now, guys, we have a little icebreaker question. So this is for you. So in order to respond, you can either put your responses in the chat box or just raise your hand so that we can call out your name if you want to speak. So the question here is, this is the activity where you mentioned about the fact, have you ever had a thought that made a situation feel worse than it already was? Uh, I'll give you an example of it. For example, someone has a stage fright and they're about to go to perform something on stage, but they have had some bad experiences with being on stage. So that thought itself interferes in their performance. So have you ever had a thought that made a situation feel worse for you from your own personal experience? It would be great if you guys can share that. Yes, Samriddhi says yes, usually happens. Okay, disappeared. Failing exams, probably. Uh, yes. Yes, Asha, please go ahead. Then we'll come to Palak. Did you want to say something, Asha? Okay, if not, Palak, you can go ahead.
Hi, sir. My name is Palak, and so I have joined in the session. Sorry, my career life right now. I'm a fresher, and last year I was not able to get much of calls or of interviews from the schools, and eventually I started thinking that I have chosen the wrong career. That made the situation a lot worse than it actually was.
Right. Thank you so much for sharing that. I hope many of us can relate to that. Also, Shruti Sharma raised hand. You want to share your experience? Okay, I guess that was a mistake. Oh, okay, moving on to the chat box. So, uh, if you want to speak up, please go ahead. So in the chat box, people have mentioned that failing exams probably, yes, that's a very relatable thing with that before exam. You have those loops of negative thoughts circling around, making you feel even more nervous than you already were. Samriddhi says usually happens before a class presentation. Yes, that is also a situation where, uh, your self-consciousness, it clouds over your preparedness. So it makes you nervous. Uh, Someone says also before giving a speech, yes, especially the public speaking situations are more relevant here. Fatma says attending interviews, yes, that is also a situation where your beliefs kick in before your performance. Kanishka says I had a panic attack in my bio practical and had a meltdown in front of external examiner. Okay, that's really unfortunate to hear, Kanishka. I hope you're doing well. And yeah, I mean, now you can understand how, beliefs about the situation, or, that forecasting about the situation, it does matter a great deal. Dr. Atmanson, one of my patients had a feeling of this when her husband gets a little bit angry. She gets started shivering because she had some past related to this issue. Right. So she must have had trauma related to the fact that when her husband gets angry, situations get worse. So that must have created a trauma, and that trauma triggers up in every situation that is similar to that. So, thank you for sharing that. Dr. Arif says, death of my father made me suffer from anger bouts. Still, I myself became a counselor. Thank you so much for sharing that, Arif. Uh, Mansi says, I asked my dance teacher to repeat the step that has to be done, but she slapped me. It kind of made me a bit hate her, and also not speaking up to this happened in childhood. Oh, that's really unfortunate, Mansi. Thank you for sharing that. Shruti Sharma says fear of failure. Yes. Pratibha says when I have to socialize with people or have a conversation with someone, yeah, it mostly happens with social anxiety as well, because those people act as triggers or reminders. Manthan says my first skydiving lesson. Okay, I think that's fair enough. You got to be nervous before the skydiving lesson. I mean, if not before, then that then where. Okay, so thank you so much everyone for sharing your experiences. Now we'll move on to the next part. So we just saw how your thoughts make this upcoming situation feel even worse. So in that case, CPT is used to help people heal from traumatic or really difficult experiences. But again, it doesn't just focus on what has happened. It focuses on what you believe about what happened. And those beliefs could be anything. Here are a few examples. It could be things like, it was all my fault, I was responsible for it. It could be things like, I'm weak for feeling this way. And it could be things like, I can never trust anyone again. So these are the beliefs that go on in loop, and whenever that trigger presents itself again, and they automatically starts to run. So now let's talk a little in detail about what causes more distress. Is it the event, or is it how we interpret it? So in the context of CPT, most of the clinical practice consistently they reveal, just a second, guys. Yeah, they reveal that the interpretation of trauma often drives ongoing distress more than the event itself. So while traumatic events are undeniably painful, it is the beliefs that follow. Beliefs like it was my fault, I can't trust anyone, I am fundamentally damaged, that frequently sustain the suffering, these beliefs. So CPT helps client recognize and challenge these interpretation, understanding that reframing these thoughts can lead to emotional relief, even when the facts of the events remain unchanged. But just the perception of it creates a lot of difference. So let's talk a little about after. So since we are talking about trauma, let's look at the fact that after trauma, what are the major, emotions or experiences that people share after going through a trauma? Because the effects of trauma, they ripple out far beyond the event itself. So client often find themselves grappling with, complex web of emotional and behavioral reactions. So let's elaborate on few of those. So the first that comes to mind is guilt. Many survivors feel responsible for what happened, even when the logic says otherwise. For example, after a car accident, someone might think, if only I would have left 5 minutes later, maybe this wouldn't have happened. So this self blame can be stubborn, and this self blame can make it hard to forgive themselves or to see the context of the event realistically, because that guilt puts the person into the center of the event, into the eye of the storm, and everything is around that eye. So the person feels responsible and the person feels guilty. Then secondly, there is loss of trust. So trauma can shatter your trust, not only in others, but sometimes in systems, or sometimes in your, even in your own judgments. So a person who is betrayed by someone close may begin to question the reliability of all relationships, making healthy connection feel risky. So this protective shield often isolates the survivors and keeping help at an arm's distance. So because even in order to heal yourself, you need to have a sense of trust. Even if you are going to a counselor, or if you're talking to a friend, you need to have that sense of trust. So yeah, loss of trust is there. Then the third one is shame. So unlike guilt, shame targets the self. Clients may internalize the trauma, believing it reveals some inherent flaw, often thinking things like, I am bad or I deserve what happened. And this feeling seeps into their identity. And that identity causes avoidance and a deep distress. So that sense of shame becomes a major part of the identity, and which interferes with the future events. So shame is a major part to be talked about. And lastly, there is hopelessness. So repeated or severe trauma can make recovery feel impossible, and it can fuel thoughts like, I'll never be safe again, or there is no way out of this. So this leads to emotional numbness, and it also leads to withdrawal from activities that they once enjoyed, their hobbies, their strength. And also they lose a sense that life will ever improve again. So hopelessness becomes a major part of your life after the trauma. So these four are the major things that people experience after trauma, which is guilt, loss of trust, shame, and hopelessness. Uh, any clarification till this part, or if this is clear, you can give a thumbs up. Someone raised hand. If you want to speak, you can just unmute, or will, I think that was a mistake. Okay, moving on to the next part. So now we'll talk about the five pillars. So the five domains where trauma disrupts the meaning making of the client. So research shows that trauma most often breaks down meaning in these five central domains. Let's have a deeper look at each of them. So the first domain of your life that is affected is safety after a trauma. So after trauma, everyday situations can suddenly feel threatening. For example, someone assaulted at night may avoid going out after sunset, constantly scanning for danger. So their sense of safety shrinks and it is replaced by hypervigilance and fear of future harm. So safety is affected in that manner. Then, secondly, the domain of trust is affected. Trust gets shaken, sometimes beyond just individual relationships. So a person betrayed by a friend might become suspicious of everyone, doubting motives, and then reading threats into neutral actions. And this eroded trust, it makes it difficult to seek support or build new bonds. So trust is affected in that manner. Then esteem is affected, and when we talk about esteem, it's both self-esteem and esteem for others. So many survivors experience a collapse of self esteem, questioning their self worth or the goodness of others. For example, after workplace harassment, a client may doubt their competence or view of authority figures as inherently harmful. Healthy self views and relationships suffer as a result of it because we start to anticipate those relationships from that standpoint of trauma. Then the next or the fourth domain is power and control, or power or control. A traumatic event often strips away the feeling of control. Survivors might feel helpless or unable to affect their circumstances. They might say things like, bad things just happen and there's nothing I can do. So, this loss can lead to passivity, it can lead to avoidance or an overwhelming need to control minor details to regain some agency. So they have lost their sense of power or control, and they are constantly looking to control minor details to have a sense of that they are in power or they are in control, because that power and control was disrupted by the traumatic event. Then finally, there is the domain of intimacy. So trauma affects closeness. Someone who has been betrayed or abused may avoid emotional or physical intimacy, fearing exposure or vulnerability. They might stay isolated, missing out on the comfort and connection that facilitate healing. Even the future relationships are under a threat. Right. So these are the basically CPT helps rebuild these pillars by guiding the clients to examine and update the belief that keep their lives restricted. Real recovery means finding clarity in danger, learning who to trust and how to trust, rebuilding self-worth, reclaiming agency, and renewing healthy connections. Right. Now moving on to the next part, which is what causes more trauma or distress. So sometimes what hurts the most is not what just happened, but how we think about what happened. So again, two people might go through the same kind of painful experience, but once one feels stuck while the other moves forward. Why does that happen? Well, that happens because their thoughts about the event are totally different and they are thinking from a different standpoint. And CPT, it helps people look at those painful thoughts and ask to the thought itself that is this thought helping me or is this thought hurting me? So CPT helps you create enough distance from the thought that whenever it kicks in, you are not just flown into its stream and become the thought. Rather than you can take a moment and look at the thought and ask yourself this question, is this thought helping me or hurting me even more? So this is an insight oriented question that every time when you put forward, whenever a trigger happens, your insight becomes even stronger. So insight is also a thing to be practiced here. Right. So any doubt till this part? If Everything is clear. You can give a thumbs up. Right. Now, we'll talk a little about the techniques that are majorly used in CPT. Gunjan says there are cases where people couldn't really change their thoughts. What should we do in that? So, there are different therapeutic modalities for all kinds of experiences, Gunjan. So, CPT is for clients who are able to do something about their thoughts, who are able to see their thoughts. That's why there is a small kind of assessment that we do of the client before implying CPT, so that we can know whether this client is you know fits into be a part of CPT or not. So we'll talk about that assessment also later. Right. Again, not all modalities are for everyone. This is our job as a therapist to make a judgment through assessment and asking questions. Right. So let's talk about the techniques of CPT that are majorly implied. So the first is psychoeducation. The journey begins with psychoeducation. The client learns what PTSD is and how trauma can twist thoughts and feelings and why these reactions occur. This sets the stage for collaborative work, demystifying symptoms like flashbacks or avoidance. For instance, a therapist might explain, it's common for memories to feel intrusive or for you to be on alert after what happened because your brain is trying to protect you, right? Then it is there. Second technique is to understand thoughts and feelings. So, clients are encouraged to write or talk in detail about their traumatic experience, a structured exercise that makes confronting their story more manageable. For example, someone might be asked to describe the event and its impact on their beliefs about trust or safety. So this helps organize feelings and memories and lessening their overwhelming power and providing space for reflection. Then third major technique that we imply is to change belief. So belief, as I told, they are also known as stuck points in CPT, and these are the beliefs that keep the client trapped in distress. So a therapist works with the client to unpack statements like "I'm weak for not fighting back," exploring evidence for and against these thoughts. So cognitive restructuring transforms these into more realistic and self-appraisals. For example, I did what I could in the moment, or my reaction makes sense given in the danger I was in. So changing those beliefs is one of the techniques of CPT. And finally, learning new skills. So as therapy progresses, clients practice new coping strategies to handle triggers or stressful thoughts. This might include relaxation techniques, self-soothing exercises, or mindful grounding. And these skills are tailored to each person's need with regular homework to inculcate changes into daily life. For example, a survivor of abuse may rehearse saying no assertively, reclaiming control in relationships. So over time, these new skills they support your long-term resilience and long-term recovery. So through these four major techniques, CPT gradually unwinds the grip of trauma. It helps client reclaim balance, autonomy, and trust in themselves and trust in others, which is achieved through these four major techniques. Now, let's talk a little bit about the uses of CPT. So, as I mentioned before as well, that mental health professionals may recommend CPT to treat PTSD or other related condition, especially where the trauma is central. that some event has happened and that proved to be traumatic for the client. So that is the preliminary eligibility criteria for you to be applying CPT. So a person can develop PTSD due to variety of life events. Uh, Kanishka says, can we apply CPT to narcissist abuse survivors? Yes, if they have had the traumatic experience with that abuser, and there you can see that there are unhelpful beliefs that are proving to be a disruption in the client's way of what they imagine their future to look like. Yes, in that case, you can imply the CPT. So yeah, there are a few examples from where PTSD is developed. Military service is one of the major factor because they see a lot of violence and killings and all of these things. They affect you on an emotional level, even though uh, you try your best not to. Even though you try your best to have a hard skin about it, but it doesn't help that much. Then, secondly, experiencing or witnessing any abuse. So, abuse could be physical, sexual, or emotional abuse, uh, like someone just mentioned in the chat box, like narcissistic abuse as well. And then, living in an area affected by war or natural disaster. So, any atmospheric troubles or atmospheric traumatic experiences can make the situation worse. For example, the war going on with Israel and Palestine. So people there must be, facing PTSD. And then finally, in a situation of accidents. So, hi, Dr. Lakshmi. In just some time, we'll talk about the differences and similarity of CBT and CPT. So we'll be covering that. Dr. Atman says family trauma. So are you asking can it be applied for family trauma? Yes, again, any experience that proved to be traumatic and then any trigger that happens or similar situation that happens, and if those thoughts, those unhelpful beliefs, they start to kick in and make the situation worse, you can apply CBT there. Okay, moving on. Okay, let's talk a little about the benefits of CPT. So, firstly, it is there. It helps. You give an improved emotional regulation because trauma often throws emotions into chaos. Clients might find themselves overwhelmed by anxiety, gripped by sadness, or suddenly angry without knowing. So CPT offers practical tools to help individuals better understand, name, and navigate these feelings. And over time, many clients report being less hijacked by flashbacks or panic and more able to stay steady in day-to-day life. For example, a few sessions, a client who once spiraled into anger after being startled now pauses and uses slow breathing and is able to express that I feel scared right now, but I know that I'm safe. So there is improved emotional regulation. Then, secondly, there is reduction in PTSD symptoms. Symptoms could be nightmare, intrusive memories, avoidance, hypervigilance, and this change often feels very gradual. One client who couldn't walk past the site of their accident learns through therapy to test their beliefs about danger. And eventually, with new perspective, triggers become manageable and traumatic memories lose their overwhelming power. Cases often show remarkable drops in diagnostic severity, and these improvements last well beyond the end of formal therapy. So, you can see the reductions in PTSD symptoms. And then there is enhanced cognitive functioning. Uh, for example, before CPT, clients might accept thoughts like I'm always in danger or I am to be blamed for what happened as facts. But through guided exercises and exercised reflection, they move towards a more balanced stance. For example, I did my best with what I knew, or some places are safe, some are not. So this shift supports reality based, more adaptive decision making for the clients. so they are able to think better about the situation. Right. So the next benefit is improved relationships. Again, as we know that sometimes trauma also damages the trust, and not just with others, but with oneself as well. So as clients reshape beliefs about their own worth and the reliability of others, they can re-engage with loved ones and even build new and healthier connections. So they may find themselves less isolated, more able to ask for help, or more willing to forgive themselves and others. For example, a client who withdrew from their friends after trauma might gradually start attending family gatherings or rekindling supportive friendship, because the old belief that people will always hurt me is replaced by some people are trustworthy. So, as a result, relationships improve. Then, another benefit is better coping skills. So, beyond cognitive changes, CPT arms clients with a toolkit for handling setbacks, from problem solving frameworks to emotion regulation tricks and assertiveness scripts. And these skills are not just theoretical, they are rehearsed, refined, and applied to the client's real world. For example, handling a triggering conversation or facing a stressful workday. So it helps you cope better with situation. And finally, there is increased self-esteem and self-compassion. And perhaps this is the most powerful transformation because it's internal. So, by working through guilt and shame, clients begin to see themselves with a kinder and more accurate eye. Someone who came in thinking that I am broken may by the end say that I survived something difficult, but it doesn't define me. So, this self compassion is vital for long term healing, and it motivates further growth. It motivates the client to have healthier boundaries and the pursuit of meaningful goals. So these are the ways which where CPT can help, and it is more than just a quick fix because we it's carried over the session of over 12 sessions, and it is practical, and it has more of a grounded approach. So it's not just a quick fix. We have to know that. So right, moving on after the benefits. So this activity is for you guys just to have a more uh, introduction to CPT. This is for you. So what you can do is that you can write down one event that upsets you, okay, and then write about three things. The first is okay. Firstly, you write down about one event that upsets you. It could be any traumatic event or any painful experience that made you uh, that gave you a lot of distress. Then write about what happened during that time, what was the trigger, right? Then secondly, what thought followed the event? What were the thought process like? Were you thinking that this is my fault, or how? Because we discussed a lots of ways of identifying unhelpful beliefs. So based on those unhelpful beliefs, you can think about what thought followed that event. And then finally, pondering over the fact what caused more distress, the event or the thought. So you can note this down and you can do it with yourself so that you personally, you can connect it with your personal life and see how the distress is caused. Is it more by the event or is it more by the thought? So, so since no one else is going to see that, you can be totally honest and open about this activity with yourself, so that you can get a better, understanding of it, which connects to your personal experience. So, I hope you all will do this. Do you want me to repeat this activity, or is it clear? Any doubt regarding that?
Yes, sir. Can you please repeat it once?
Okay, so any event that upsets you, it does not have to be a major trauma, but it can be anything. Even if it's a major trauma, you want to mention it, you can mention it. For example, let's say I write down about an event that in school I had to perform in front of the audience. And when I had gone blank and nothing was coming into my mind. And that situation was so embarrassing that people were laughing at me. And that situation became a traumatic experience for me. So I will write what happened during that time. For example, I was on the stage, people were looking at me, people were expecting me to perform, and I was under the performance pressure. So that's what happened. Then, secondly, what thought followed the event? So during that time, for example, I must have been just looking at the audience and looking at their faces. They want, me to perform in a certain way, or they have certain expectations of me, and they are really strict about those expectations. And I am thinking more about performing. My thoughts are like, will I be able to perform? Will I be able to do this? There are so many people. Will I be able to do it correctly? So these are the thoughts that I am having during the event. But when thirdly, when I later sit and think about the event, I am going to ponder over the fact, what was more stressful for me? Was it the event itself? Was it the fact that I have to go to the stage and speak something or perform something? Or was it my thoughts? That thought that says to me that, will you be able to perform? There is such a immense pressure on you to perform. So those thoughts make you attracted towards that thought only, and not on your performance. So it is just for your understanding. This is how you can connect your personal experience with CPT and see how uh, it can be seen in a situation. Right. So this is the activity which you can do it for yourself. And now moving on, uh, just to give you a gist of what we just discussed, then I'll be handing it over to Manvi to cover for the next section. So we just discussed that CPT is an evidence-based trauma therapy. Its focus is not just on the event, but how we interpret it. Then we saw how trauma can lead to painful beliefs like it was my fault or I am broken. And the goal of CPT, it is to identify those painful beliefs, to challenge those beliefs, and to reframe those beliefs or those stuck points to more adaptable ones that are more in alignment with the client's desired future. And now I'll be handing it over to Mandvi to take the rest of the session. So over to you, Mandvi.
Yes, thank you, Arpit, for that. Um, yes, so I hope I'm audible. Give me a thumbs up. All right, thank you for responding. Thank you for being engaged. So now, why CPT, right? Out of all the therapeutic modalities we have discussed, why is this important? All right. Um, because, as we are aware, up until now, right, what maintains post-trauma distress for a client is not the trauma itself. It's not always about the trauma. All right. It is more about the interpretation of the trauma, the unexamined interpretation that the client has. All right. And we know by now through decades of research that, that consistently show us that when we change the meaning clients assign to their trauma, that leads to emotional and, physiological, psychological healing for the client. It's very powerful. So when the beliefs start to shift for the client, right? Client see changes in their mood, they see changes in their self-worth, they see changes in their behavior as well. All right. They also move away from being defined by the trauma, which is very important for any trauma survivor. And they also learn to reinterpret it as one of the chapters of their book and not as the entire whole book, if that makes sense. I'll give you a little example here. So there was a client, for example, who survived a car accident, and now she blames herself for her friend's
Someone
injuries.
goes through something painful and comes up and just my
I'm sorry to
no,
repeat. What was that? Were you saying something? All right, we'll take questions towards the end. No worries. All right. So we'll proceed now. So I was giving an example of somebody who has gone through a car accident. All right. So after the car accident, they blame themselves because of their friend's injuries. The friend and she were traveling together. All right. And since that event, she has avoided. Um, if you can mute yourself quickly, that'd be lovely. We'll get back to you. All right. So since that event, she avoids driving altogether. She has isolated herself, and she also carries this intense guilt in her. As you know, guilt and shame is something which we will cover in the coming slides, which is very prevalent in somebody who is a trauma survivor. All right. So now through CPD, what can you do as a clinician, as a practicing psychologist? Um, you can collaborate with the client and help her to learn how to examine the evidence, as I've mentioned. Okay. And you can also help them to understand that she had no control over the external circumstances, right? Which is very important. And with time, gradually, right, her self blame would soften, which is very important. Self blame, as I mentioned, is a very prevalent, emotion in somebody who's gone through trauma. The self blame would turn to compassion, and she would begin to re-engage with her environment. She would begin to drive again. She would begin to socialize again, emotionally, physically, and everything, right? So, which is an ideal state for us as clinicians. Next slide, please, Arun. All right. So, at the core of CPT and any cognitive processing therapy, anything, right, um, is the principle that our thoughts drive emotions, and those in turn drive our behaviors. Very simple, right? We all know this. I'm hoping. Um, so trauma does not just simply leave us with difficult memories, or does not simply leave a client. You know, um, it reshapes the entire belief system. It targets their thoughts. It targets their core beliefs. All right, and as a result, client clients often form these rigid, very global conclusions about safety, control, or trust, as Albert mentioned as well. Um, Trauma. I want you to listen to this very carefully now. Trauma disrupts our um, core beliefs, right? Core beliefs about ourselves, about the world, about our relationships, right, with other people. So when trauma disrupts our core beliefs, for our ease in understanding as clinicians, we've categorized 5 core belief themes, right? As I has also mentioned. Um, this forms a framework for us to understand, where the uh, disrupted core belief comes from, so that we can formulate a treatment plan accordingly. For example, somebody can form conclusions about safety, about control or trust by believing that I can't rely on anyone, or I am permanently damaged after that incident. All right, so that is something which is targeting, or which is falling under one of the core beliefs that we discussed. And the worst part is, right, these distorted beliefs feel completely true to the client, right? Of course, we know we are able to distinguish what's true from what's not, right? But these beliefs seem very true to the client. Um, and of course, they're very rational as well, right? The therapeutic, takeaway for all of us here then is to address the meaning making, right? How does the client interpret the past events? How can we reframe the meaning of the trauma? Because we are not just symptom managing. The client comes to us, we're not just symptom managing them, right? We are helping them reframe how they interpret the event. We are working on the root cognitive mechanisms. all right, which is again fueling the distress, which is sustaining the distress. All right. I'll give an example here, very quick example before we move on. So there's a survivor of workplace harassment, all right, and they believe that they are incompetent and everyone will, reject them as a result. So of course, this thought then would fuel avoidance. It would, fuel anxiety in them. So through CBT, as clinicians, what can we do? We can examine the evidence. We can examine their performance reviews, the feedback they received, the reviews from the supportive colleagues, right? So we can examine the evidence alongside them and introduce balanced alternatives, very similar to CBT. All right. And over time, of course, that will, decrease the avoidance behaviors and rebuild confidence in the client, right? Something simple. Next slide, please, Arpit. All right. So here in front of you on the screen is a very simple but a very powerful model. And for those who've asked, key distinctions between CBT and CBT, we'll come to that. That's coming. All right. But it's important for us to revisit this model here. So as you can see on the screen as well, thoughts shape our emotions, our feelings. That in turn shapes the physical sensations that we have. And then that leads to changing behaviors. And of course, that would again influence or reinforce the thoughts in the first place. So it's a circular model here. So trauma, when you think about trauma, right, any traumatic event, that can trap clients in this feedback loop that you see on the screen. For example, I'll give you an example which will help you understand this model better. A client might think, I am unsafe. So that's a thought, a distressing thought right there on top, all right? Which will in turn create anxiety, distress, all right? Which will fuel anxiety for the client. Then, as a consequence, the body would react, all right? So they can have a racing heart, they can have a tight chest, or, hot and cold flashes, sweating, whatever the physical sensations are for them, all right? And that can, of course, and that would lead to behavioral consequences. For example, the most common here is for any traumatic, survivor is avoidance, right? So that can lead to avoidance. Now, the irony here is that somebody, who's avoiding as a result of, undergoing this loop here, would momentarily find relief in that, in this, while engaging in avoidance, right? It will reduce anxiety. But in long term, what it will do is it will reinforce the thought at top here, which we discussed, was that I am unsafe, the world is dangerous. It will keep on reinforcing, it will keep on strengthening the loop here. All right. So I hope you understand. Give me a thumbs up if this is clear. All right. All right. So now CPT here would intervene at the topmost level, right? As you can see, it will intervene at the level of cognition. Because once you alter the thought of the client, as we know, right? This is pretty easy. When we alter the thought, the rest of the loop would follow. We'll be able to break the loop. Because as a consequence, the emotions, the feelings that the client is going through will soften, the distress will lessen. The physiological arousal, for example, the chest tightness, the hot and cold flashes or whatever, would lessen, would reduce, right? And the behavior also, for example, the avoidance behaviors, right, would decrease as a result. So that is what we're trying to aim for here through CPT. All right. Next slide, please, Arpit. Okay. So now let's look at this very, very simple scenario. Arpit has already mentioned, gone through a lot of questions like this before. So it's pretty simple here for us. Two students now score the same, a grade, which is 60%. One of them, the first one, thinks that they are stupid and they'll never be good enough because of that grade. The other one thinks to themselves that, it's okay, I didn't prepare well this time. I can improve next time. All right. So who do you think feels worse? The first person, the first student, or the second student? I want quick answers in the chat box. Right, definitely. Um, More people, please. Few more answers. It's pretty simple. All right. So, how many think um, that the first person, the first who would feel worse? Give me a thumbs up. Yeah. Thank you for responding. Yes, exactly. And who do you think would be able to bounce back quicker? The first student or the second student? Give me a thumbs up for second student. All right. Thank you for responding. Yes. So we got the gist of it, right? It's not the event that determines our emotional distress or the client's emotional distress, right? It's the interpretation we make of it. It's pretty simple. Pretty simple, but then again, it does affect all of us. In trauma therapy, for example, right? Anything centered around trauma, right? Clients would often interpret events through a very self-blaming lens. They would, if you had a client who've gone through traumatic events, you would know what I'm talking about, right? They would often interpret events with a very self-blaming lens. All right. CPT would help you and them make these patterns visible. All right. Um, and once, as a result, when clients come to realize that that their thoughts shape their distress, it's not just the circumstances adding to their distress, it's their thoughts as well, right? They would feel then empowered to challenge those interpretations. All right, they'll be better able to come out of it, right? They'll progress, and you'll see clinical recovery sooner. I hope this makes sense. Give me a thumbs up. Very simple. All right, thank you for responding. Next slide, please, Arthur. Now, a very important concept in CPT is of stuck points, right? A lot of you guys asked Arthur, how does CPT and CBT, how are they distinct, right? Stuck points will help you understand how. One of the ways, of course. Stuck points are any beliefs that are very rigid. They are very overgeneralized. All right. And of course, as a result, they block recovery for the client. They block emotional recovery. For example, the client might have this very rigid belief after that traumatic event that, if I acted differently, for example, it wouldn't have happened for me. Maybe it happened because of me. So these rigid, unhelpful beliefs post-trauma really blocks one's recovery. All right. And such beliefs are typically absolute. All right. So they always contain words, phrases such as should, always, never. All right. I should have acted this way. I always do this. And as a result, this happened to me. I shouldn't, I should have never gone there. This was my fault. Right. So these statements, these phrases here, should, always, never, are typically present in such beliefs because it makes them more absolute, right? And why are they present in these beliefs? Because they then sustain guilt, shame, and avoidance for the client. All right, so that is something that's happening for the clients. How many of you are taking sessions? How many of you are seeing clients? Can I see a few thumbs ups? All right, thank you for responding. Thank you for answering. All right, so if you've seen any client with a traumatic history, all right, you would often see that your clients were replaying the trauma repeatedly, all right, repeatedly in their heads, right? But even replaying the trauma wasn't getting them anywhere. It wasn't giving them any new insight. It was just, making them stuck in the past, right? Because, that's why that is happening, because their cognitive framework hasn't shifted. They're stuck there with no new insights to follow. All right. I'll give a very simple example here. Um, a survivor of domestic violence, for example, might believe, right? If I had been calmer, he wouldn't have hit me. All right. So that's a stuck point there. Through CPT now, we can explore the logic of that statement, its origins, where it's coming from, and its consequences. And over time, of course, the client can learn to separate the responsibility from the circumstances that happened, that occurred. All right, so this reframing within the sessions, of course, would lead to self-compassion, would lead to recovery for the client. Now, in case anybody of you is wondering how stuck points differ from cognitive distortions, right? A very simple distinction, or as how I understand it, stuck points are primarily trauma focused, right? They are trauma centered. Cognitive distortions, on the other hand, is pattern centric, pattern centered, right? So cognitive distortions can be prevalent and present in a lot of mental health conditions. Hi, Kriti. We'll get back to you. Yeah, thank you for that. So as I was saying, cognitive distortions is present and prevalent in a lot of different mental health conditions. Maybe somebody with anxiety has, cognitive distortions, depression, maybe even somebody with trauma can have cognitive distortions, right? Stuck points, on the other hand, is solely for somebody who's gone through something traumatic. It follows a traumatic event, right? So these stuck points here would keep the client stuck to the past, the traumatic event, due to these unhelpful rigid beliefs surrounding the trauma. It's not generic, it's trauma centric. I hope this makes sense. It's a pretty important distinction here. So now another thing to take note of, somebody who is who's a trauma survivor, for example, right? They can have both stuck points and cognitive distortions, right? Or they can just have stuck points, right? That is very variable and depends, it's subjective. All right. Now, how do cognitive distortions and stuck points coexist side by side in somebody who's a trauma survivor? Cognitive distortions would then fuel and add distress to the stuck points and to the client himself, if that makes sense, right? So they're working together to fuel distress then. All right, so cognitive distortions would be the pre-existing distorted thinking patterns, right? That would work alongside with the stuck points that the client has developed post the traumatic event. I hope this makes sense. Give me a thumbs up.
Hi, I'm sorry. I just want to ask a question if I may.
Yes, please go ahead.
Can you maybe just go over the trauma centric part again, please?
Yes, so I was talking about stuck points, EJ here. Stuck points are trauma centric, right? They're centered around trauma, around traumatic events for the client, right? I was helping you understand the distinction between stuck points and cognitive distortions here. Cognitive distortions are more generic, right? They're more general and they're pattern specific. For example, somebody can have black and white thinking or, emotional reasoning or mind reading or anything else, right? So that is more generic, for example. It can exist in any mental health condition. All right, stuck point here would be very exclusive for somebody who's gone through a traumatic event. It will be centered around one's trauma. Any rigid unhelpful belief centered around their trauma. For example, if you can see on the screen, if I acted differently, it wouldn't have happened. right? It's very trauma specific, which is again blocking their healing, their recovery. All right, I hope this makes sense.
Yes, thank you.
All right. Um, all right. Okay. Just give me a second. We can move on then, if everybody's clear. Yeah. Next slide, please, Arthur. So now the CPT process, right? CPT follows a very clear step-by-step process here for you guys. Um, because we want to help the clients process their trauma safely and effectively, right? Good time. The first step here is to understand the thought processes. All right, so we begin by mapping how clients interpret their experiences, their events that have happened in the past. All right, that is the first step. The second step here would be to identify stuck points, as it already covers, stuck points are any rigid, unhelpful beliefs surrounding the trauma. So the second step then would become for us to detect any rigid beliefs around trauma that's been fueling the distress in the client. All right. And there are different tools for this as well. We'll come to that later. The third um, part here is to challenge beliefs. Yes. So third part here is to challenge beliefs, right? So we're examining the logic, we're examining the evidence, as Vikas mentioned. It's quite similar to CBT, but again, we'll come to this distinctions later. We are still examining the logic, the evidence, right, and the cost of maintaining those beliefs with the client before we come to restructuring. All right. The fourth step again here is to reframe through evidence. All right. So after we've done challenging our beliefs, we come to reframing, restructuring. All right. So we will replace any distorted interpretations with balanced, realistic perspectives. And as I mentioned, a person who's a trauma survivor can have both stuck points and counter distortions, right? So you're challenging beliefs for all these rigid and helpful thought patterns, belief patterns. All right. Then you're restructuring them through evidence. The second last step here would be to note emotional shifts. So tracking, how the emotional tone changes as the beliefs start to change. That's very important to track one's progress, to reinforce, commitment, to help the clients stay committed um, to, recovery, to working on themselves. The sixth step here, of course, is very similar to what we do in CBT, is to practice homework with homework, right? So what that does for us is, just a second, Erica, I'll come back to you. So what that does for us is we are reinforcing what we've learned in all our sessions through practice. We're consolidating everything we've learned. All right, yes, Erica, please go ahead.
Hi, good afternoon. So I'm confused about the emotional shift. So basically, if we do notice emotional shifts, how do we address them? And then how do we proceed with them? There are emotional shifts. So how do we address them with the client? How do we go forward with that?
Yeah. So when I say note, right, you can make use of assessments, you can make use of self-rating inventories, right? The main idea here is to help the client understand how all of this is coming together for them, how all of this is working out for them, right? So we are trying to reinforce um, their, their commitment, and that makes sense. All right, so it's more of a progress check, if that makes sense. Erica, does it
Yeah,
make sense?
yeah, it makes sense. Thank you.
Yeah. All right. Any other questions? Pretty simple. So each step here is quite evidence based. All right, and it's sequenced very intentionally. You cannot skip a step, or you cannot, uh, you know, uh, take one step ahead over the other. All right, it's sequenced very intentionally to prevent re-traumatization for somebody who's been through trauma. We don't want that to happen, right? So to avoid that, these steps, this sequence here helps us to achieve that. It also maximizes the engagement of the client, their commitment throughout, therapy. So that's important. Any questions here before we move on? All right, then we move ahead. Arpit, please next slide. All right, so as Arpit has already mentioned, we do make use of a lot of structured evidence-based tools in therapy with CPT. All right. Um, so these tools are not just about filling worksheets with the client, right? It's not about that. It goes beyond that. It's about helping the clients see their thoughts, which are of course in front of them, um, rather than just living inside of them, if that makes sense, right? So helping them objectively see what they're going through, assess what they're going through, right? It's not just about filling worksheets there. So when the client writes about why the trauma happened and what it means to them, right? That's an impact statement, right? Why the trauma happened and what it means to them. They begin to surface hidden beliefs, all right? And if you are a practicing clinician, and if you, of course, take up CPT, and if you, work with the client to come up with an impact statement, which is just simply helping the client write about why the trauma happened and what it means to them, that will bring up a lot of hidden beliefs underneath the surface. And you'll also realize, and the client will realize, right, that the distress is not coming from the event itself, but from what they've come to believe of it, right? And that's a very important realization to have as somebody who's gone through trauma. For example, a client might write, "It means I wasn't strong enough." Okay, that single sentence then becomes a window, a way into the deeper self-judgment that they have about themselves. All right. So this is where CPT work would begin for you as a clinician. You're trying to unravel the meaning, the layers beneath, their statements there. The next thing would be to track distressing thoughts. All right. Tracking distressing thoughts that are allowing clients to recognize emotional triggers in real time. All right. So it will help clients recognize what the emotional triggers are, which is very important. And of course, with sessions, with every session that you take over the course of a few weeks, patterns would then start to emerge. All right. For example, it could be repetitive guilt. It could be mistrust, or should have thoughts, right? The yeah, we've covered absolute phrases, right? Should have thoughts as well. So this awareness for both the client and you, would form the basis of belief testing, evidence-based testing. That makes sense. All right. So everything is sequenced. Everything is meant to happen in a certain way, unfold in a certain way. And after belief testing, right, evidence-based testing, we come to guided questions. All right. Through guided questions, clients would then learn to test the accuracy of their beliefs rather than just accepting them as facts. All right, very important. We'll come to guided questions in a few slides. Guided questions can really help you and the client to gently shift their thinking from blame to more compassionate sort of perspective, more, perspective taking in general, if that makes sense. All right. So these tools, together, we'll come to more tools in a few slides. These tools will then act as a mirror for the client. All right. And help them to move towards a more balanced and compassionate understanding. That is what we're trying to achieve here. All right. Anything, any questions here? Pretty simple. All right. Okay. Next slide, please. Okay. So now coming to the emotional shifts here. All right. One of you asked about emotional shifts. We come to that now. So CPD is not just about cognitive work with a client. All right. It's about deep emotional work as well. So when the clients learn to challenge their beliefs, their thoughts, right, their emotional experiences change. Their emotional landscape will change altogether. For example, I'll give an example here, as you can see on the screen. Guilt would shift to balance, ideally. Guilt would shift to sadness, ideally. All right. Um, so the client might have the realization that, and shift from I'm bad to I lost something precious, right? So I'm bad would signal guilt, and I lost something precious would, suggest sadness, right? Sadness would then become a healthier, self-compassionate emotion here, which is more ideal for us, more self-compassionate. All right. So through practice, through CPT intervention, you'll observe these emotional shifts happening in real time. The second shift here is of anger to acceptance, right? So clients would move from they ruined my life to it will hurt deeply, but I'm not defined by it, right? So there's less self-blame from the client's end, if that makes sense, right? So this shift again is ideal, is acceptable, is would suggest uh, emotional progression, emotional recovery for us as clinicians. All right. The third example here on the screen is a shift, an emotional shift from fear to cautious re-engagement. All right. So the clients might start testing safety again, at their pace, of course. They may start to join social events at their pace. They may, start to drive again. They may start trusting people around them again, slowly, of course, at their pace, right? So cautious re-engagement is something which is ideal for us as clinicians, with time, of course, with interventions. All right, this is something we do observe, towards the end, if this makes sense. Give me a thumbs up if you're clear on this. All right, all right. Okay, thank you for that. Thank you for responding. We can move to the next slide now. All right, so again, um, a very important topic here. And this question a lot of you have brought up is how is CPT different from CBT? All right. Now, first things first, CPT and CBT both share foundational principles. You know that, right? Both come from cognitive processing theories, right? So they do share a foundation. We know that for both the techniques, thoughts would drive emotions, and that is something which will drive our behaviors. That is simplified and understandable, right? We also know, which is common amongst these two approaches, is that distortions can be challenged. Maladaptive thinking patterns can be challenged. All right. And we also use homework and structured interventions with both these approaches, right? And that is something which is common, something which is similar for both these approaches. But how does CBT differ in scope, in focus from CBT here? CBT is very trauma focused, all right, and it's very manualized in a sense. It is very structured It's 12 sessions only. All right. It also uses stuck point logs as as tools, and also uses trauma related belief themes to guide interventions, which Arpita has already covered. There are five trauma related belief themes which are affected due to um, the traumatic event, right? So that is something which is the trauma is affecting our core beliefs, and the core beliefs are categorized into these five categories for our ease in understanding. All right, so this is something we use to guide interventions. CBT, in contrast, if you can see the point in the differences, CBT then is more broader, right? It is used for a lot of different mental health conditions, maybe for anxiety, depression, OCD, and so on, right? It's more broader in use. And it's also very flexible, right? You can use it with any, like you can go on that structure. You can then go on for more sessions depending on the client needs and their presenting concerns. All right, I'll give you a little clinical tip here for anybody who's practicing. If you have a client, right? If you have a new client come in, for example, and trauma is the core concern for them, all right, CPT would then be at the forefront. All right, it'll be the sharper, the more efficient tool, um, as a clinician for you to handle. And in case, it also involves generalized emotional distress without trauma themes, then CBT would help you better, if that makes sense. All right. Can CBT be used for treating phobias? I'm afraid not, Rita. In that case, CBT would be more efficient. CBT is very trauma focused, and if a client is coming in with trauma as their core concern, then CBT would be your go-to therapeutic approach. If that makes sense. Any questions here? If it's clear, give me a thumbs up. All right, all right. Thank you for responding. Thank you for being very engaged. It's been a while. Yes, EJ, please go ahead.
With CPT being more trauma focused and CBD being overly used, where you can use it for more than 12 sessions, CPT, in your opinion, you can also use it when people struggle with negative thoughts and emotions about themselves, where it impacts their self-esteem. Would you say it would be beneficial for them as well to try CPT, where we can change the narratives of their thoughts, and that could also help their self-esteem?
I'm sorry I missed the first half of the question, but if I'm not wrong, you're asking me if CPT can help change the narrative and the distressing beliefs and the thoughts that the client has.